I started gaining weight after I had my first child.
I've struggled with weight my whole life. It's been a problem since I was younger.
I had a weight problem growing up. I was never what you would consider, I would never be classified as obese.
When I was probably 5, actually, I started just getting a little bigger and a little bigger and a little bigger.
My diabetes got out of control. I continued to gain weight.
I have arthritis and it's really bad in my knees, and the weight was just making it absolutely terrible to get along. I mean, I was really struggling with it.
When I entered into my adulthood, I continued to put on weight. You know, I had 2 babies.
It just kept going, and by the time I was 12, I was definitely considered overweight.
I would diet, I would lose weight, I would gain it back, plus some. I would diet, I would lose weight, I would gain it back. I think I have tried every diet, every plan, every strategy out there.
I finally just decided I'm not going to be working in a year because I work on my feet all the time if I don't get something done.
My doctor back home wanted to see if possibly gastric bypass was an option for me. So he sent me to the Nebraska Med Center where I had visited with Dr. Kay, and she had recommended that possibly there were some other options for me that she wanted to try first.
They suggested with my sugar addiction type stuff that the bypass would actually be a better surgery for me.
My doctor found out what the causes were. That's when he got in touch with the Med Center, and they worked together to figure out what needed to be done.
I have been overweight or obese my entire life, and when I was 33 years old, after trying and failing multiple diet attempts, I decided to have a laparoscopic adjustable gastric band, and my operation was converted to a laparoscopic sleeve gastrectomy. That happened about a year ago. I'm now down 50 pounds. My health is significantly better than it was 50 pounds ago, and I am still losing and still on this same behavior and diet modification journey that I share with my patients.
There are a number of different components that we use to help people lose weight. We always begin with intensive lifestyle that includes behavior modification, diet, exercise, and kind of try to bring that to the forefront and make it possible for the patient as the main focus. After that, are there medications that are causing weight gain that probably can be changed, or can we actually use a weight loss medication? Very often surgery is an answer for some people, and so we try to see what will work for the patient.
One of the strongest things about the program here at the Nebraska Medical Center is our commitment to the process and to the patient as a whole. We want you to have the right tools, get the right tests before surgery, be prepared properly before surgery so that you have the greatest success.
All of the operations are tools to help people lose weight, and the tool has to be used properly. They have to change what they eat, they have to change how they eat, they have to change how they cook, how they shop, how often they eat out. They have to incorporate exercise into their life, or in the long term they may not be as successful as they'd like to be.
One misconception that a lot of patients have is, well, weight loss surgery is cheating. And I really want to stress that this is not cheating. It's a lifestyle change, and it's hard work.
What makes me happy is if I have made a change in somebody's life. If there can be positive changes that helps the patient live longer and live better, then I'm happy.
Over a course of 8 to 9 months, I have lost nearly 120 pounds.
I then have lost 60 pounds total. I feel great now. I'm off all my insulin.
I've done more in the last year than I probably did in the 5 before, so it's been a big change.
Day of surgery, I weighed 485 pounds. As a week ago, I weighed 172 pounds.
Now I'm healthy, I feel great, I know what I need to do to continue and to keep it off. I'm right where I want to be, and I'm healthy.
I'm seeing muscles that I haven't ever seen. I'm seeing, granted I don't have a six-pack, but I'm seeing a line, a ridge. I'm seeing things on my body that I haven't seen in a long, long, long time, if ever.
They're very good, very, very good, great. So inspirational people. I mean, even the people that do all the interviews before, very upbeat people make you feel really good about the whole thing.
They're my support system. They're there for me. They want my success just as much as I do.
I enjoy coming back here because it's kind of cool, because every time they're just like, whoa, it's different. You're different again, because I come back every year. So it's kind of fun. They watch me grow up and grow down.
you can do it. You know, if I can do it, anybody can do it.